All right, so as football season gears up across Cincinnati, UC Health sports medicine experts, they're reminding the community to try and make concussion prevention a priority. So emergency medicine physician Dr. Dan
Garin
is here to tell us a little bit more about that. Such an important topic here. We're talking about, a sport that's certainly very popular, certainly very dangerous. When it comes to concussions, obviously there's been more awareness, right? Especially in the past 5 to 10 years. But this is still an issue that is, one that looms large, certainly over people who play football themselves or know someone who does. And speaking to concussions, what would you say are maybe the main things that people don't know about concussions?
Absolutely, it's a great question. And when we talk about defining concussions, actually surprisingly, concussion's pretty hard to define.
Okay.
But when we talk about sports-related concussion, it's really defined as a traumatic brain injury that is a result of a force, a direct blow to either the head, the neck, or even the body.
Yeah.
That sends like this transmissive force to the brain. And then results in a kind of complicated and not entirely understood sequence of events, metabolic, microvascular, that then leads to injury to the brain. And what I often explain to patients is that it's really not something that we can see on like an image, like a CT scan or an MRI. And so it's purely a clinical diagnosis. We're basing it off our history and our physical exam in order to diagnose it.
Wow. Okay. So what would be the signs, right? Let's say that a mom is picking up her kid from football practice and may or may not notice, that her son might have a concussion. What would it be smart for parents to look for?
Sure. So probably the most well-known symptom is a headache, right? But it's not the only symptom, and certainly you can have a concussion without even having a headache. And so what people often pick up most is this just general feeling that someone's not acting right. Mm-hmm. They're maybe a little bit more sleepy than they normally are. They're in a brain fog. They could be complaining of things like blurry vision, ringing in their ears, nausea. Concussion can have a lot of symptoms. And so that's why it's really important for, on the sideline or at home, people who know these athletes the best in order to identify these symptoms, because those are often the people who can pick up when someone's just not acting right. And so that's why we talk about sideline culture in sports. And so super important for there to be education and empowerment amongst athletes, teammates, friends, coaches, staff, so if somebody can speak up and say something, so that they can get evaluated.
Absolutely, and I think that's so smart too, because it's not smart to ask the person who may have just had a concussion if they believe they just had a concussion, you know what I mean? So let's say that they are having or witnessing any of those symptoms that you just mentioned. What should they do from there? Do they need to call the doctor right away? Do they need to go to the emergency room? What's the process after that?
Yeah, it's a great question. Certainly depends on the setting, right? If you're alone, if you're a parent with your child and you're concerned they're exhibiting signs of a concussion, what you want to be looking for is if red flag signs that would make you be concerned that they might need to be evaluated in the emergency department. Those could be things like really severe headaches, lethargy, confusion, or severe nausea and vomiting. Those would be signs, red flag signs, that you probably should get them to the emergency department. More mild symptoms, people can be observed. It's a good idea to reach out to if you have a primary care physician, or if your school employs a team physician or an athletic trainer, to get eyes on your child.
Absolutely, because I'm sure too, the quicker that you can get it figured out, the better. Where can people go for more information and to find out more about this?
Yeah, certainly at our website, the UC Health Orthopedic and Sports Medicine Department, we see all sports-related concussions. If anybody wants to reach out for an appointment, our phone number is 513-475-8690. So we're happy to see all sports-related concussions in our clinic and kind of give the expertise to get you guys back in the game.
Absolutely. Thank you so much for talking with us here today. I feel like it really cleared a lot of things up for me, and it's important stuff for people to know, especially as we head into high school football season. Thank you, Doctor. Appreciate you.
No problem.
It's 10:28. We'll be right back.